Pfizer announcing today its coronavirus vaccine is more than 90% effective in preventing COVID-19. The medical community applauding the news, but saying we still have a ways to go.
I was expecting a vaccine might be 70% effective if we were lucky. So this is better than I was expecting. It's still early in terms of production. It's going to take some time to get the vaccine out to the American people, but this is clearly a positive step forward.
If it truly is 90% effective, it could have a dramatic effect on this pandemic in the long run. It's not going to help us this winter, but it could be a real game changer.
NBC News medical contributor Dr. Lipi Roy joins me now. Dr. Roy, it feels like it's been such a long time. I haven't seen you since before the election. Wonderful to have you back on. And we have a whole lot of COVID news to get to today. So let's talk about this Pfizer news. It's based on early data. This trial is still going on. What important information do we still need here?
It's so nice to see your adorable face, Allison. Yes.
Right back at you.
So yeah, you're absolutely right. So the preliminary data from 43,000 volunteers from 6 different countries has shown some really good news. So let me start there. 90% efficacy of this vaccine, Allison, is up there with measles and chickenpox vaccine levels of efficacy. Unbelievable. And in addition, this particular vaccine targets the spike protein, which is the part of the protein of the virus that anchors or attaches to the human cell, invades it, and then allows it to infect. This is good news because even Dr. Fauci said that the fact that we're using this as the target, the spike protein, means that it's an effective, wise target. In addition, the technology, this mRNA vaccine or messenger RNA, it's the fact that it's working at 90% efficacy tells us that this platform, this mRNA platform, can be effective. And the other good news is that Pfizer said that this is going to be free to the public. So we have a lot of promising news here. But Allison, I also have to share some other areas of caution. So first of all, we need the actual original data, not just a press release. So we have actual information. In addition, we don't know the duration of immunity or protection, and we don't know how frequently this vaccine needs to be administered. And then the other issues are really logistical. So remember, these are 2 doses that need to be given 28 days apart. And it has to be shipped and stored at -70 degrees Celsius. That's going to cause a lot of limitations, or we just have to ramp up and build the appropriate infrastructure for this. But all in all, Allison, I think this is really promising news. The other issue, though, is that it's not available yet to the general public. Probably won't be available until like mid-2021, Allison.
So let's talk about that then. Dr. Roy, health officials across the board have been warning about a dark winter ahead. We heard Dr. Besser in the intro saying that this probably won't do much to change that. Do you agree there? Is there any impact this could have in making this winter less problematic, or will we just not likely have a vaccine widely distributed before the winter's over?
Yeah, I wish I could tell you that it's available now. And actually, the Pfizer CEO did say that they'd have about 50 million doses maybe by December, but no, the message still needs to remain the same. And in the earlier footage that you showed, I'm so glad that President-elect Biden is talking about the other preventive measures that are really the only things that we have. You got to still wear that mask, and you've got to maintain that physical distancing of 6 feet. Allison, those are the 2 things that really must happen. You're absolutely right. By all measures, this winter period is going to be a dark one. We're already seeing record high 120, 130,000 new infections a day, which means that there's going to be more hospitalizations and sadly more deaths. And that's deeply concerning to medical and public health professionals, Allison.
Yeah, Dr. Roy, it is incredible how the cases just kept creeping up, but we were also distracted with the election, coronavirus really not going away at all. The director of the World Health Organization congratulated Joe Biden on his victory this weekend. Here's what else he had to say.
We congratulate President-elect Joe Biden and Vice President-elect Kamala Harris, and we look forward to working with his administration very closely. We need to reimagine leadership built on mutual trust and mutual accountability to end the pandemic and address the fundamental inequalities that lie at the root of so many of the world's problems.
Dr. Roy, the Trump administration withdrew from the WHO, but the president-elect's transition team says that he will reverse that decision on day one. Can you just explain to our viewers the importance of the U.S. renewing its partnership with the World Health Organization, especially during a pandemic?
Allison, I cannot emphasize this enough. If you recall, on Saturday night, President-elect Biden said during his speech from his home state of Delaware, the first thing he was going to do is get control of this pandemic. And one of the second things he was going to do is reinstate our relationship of the U.S. with the World Health Organization. It's important for viewers to understand that the WHO plays such a major role in facilitation, in coordination with multiple countries, not just vaccines, but I mean, other medications, healthcare workers. I mean, it does a lot of work that just frankly doesn't get media attention. So reestablishing this relationship is going to be absolutely key, Allison.
Dr. Roy, President-elect Joe Biden also announced his coronavirus advisory board today. What else would you like to see from the Biden administration as it's preparing to tackle this pandemic?
Yeah, well, I'm already very reassured because one of the many things he said throughout his campaign, and then again reinforced it on Saturday night, is just he's going to listen to science. Science is going to drive policy. And looking at the transition team, his coronavirus transition team, full of really highly qualified scientists, physicians, doctors, scientists, as well as people that are experienced in taking care of vulnerable populations, people of color. So all of this is highly reassuring. And he also mentioned this in the footage that you showed earlier. He's not just focusing on like prevention as he should and vaccines, but also testing, contact tracing and testing, and all the other measures that are needed to handle this highly complex pandemic, Allison.
Dr. Roy, as you mentioned earlier, it is easy to get excited when we hear positive news about the vaccine today. I mean, here in New York City, it's a gorgeous day. It's warm out. It's hard to even think about the tough winter ahead. But a pretty disturbing reminder that in America today, as many as 74 million essential workers and their families are at increased risk for COVID-19, in large part because over 3/4 of all essential workers can't work from home. That is according to new research that was published in the Journal of the American Medical Association. As the incoming administration makes decisions about reopening or further closing the economy and about vaccine distribution, how can they best help this high-risk group? We're talking about millions of people who are just exposed and at risk every single day.
You're absolutely right, Allison. So this new study published Journal of the American Medical Association showed that work-related exposure to COVID-19 not only endangered the actual workers themselves, but also their family and household members. And in fact, of the 56 to 74 million adults who couldn't work from home, it showed that 49 to 60% were at risk for severe COVID-19, and 71% had essential jobs where they could not work from home. And in addition, their family members, as a result, because of the work-related exposure, they brought the risk of illness back home to their family members who could have been elderly, who could be children, immunocompromised family members. So the new administration needs to work really hard to protect people who are at increased risk, including people of color, Native Americans, elderly. We already know all these factors. The work needs to be done, though.
Dr. Roy, so great to see you. I know we'll be talking to you much more in the days ahead. Thanks for being back with us.
Great seeing you as always, Allison.
Allison, it's been a very good day in the markets for a few reasons. Let's start with the vaccine announcement. Pfizer announcing they're one step closer to a vaccine. Hugely positive news in the markets, not just for Pfizer and not for the industry, but really for the economy at large. Think about all of the industries from travel, hospitality, retail, personal care, healthcare that have been negatively impacted. We've got 27 million jobs in this country that are contact jobs. So whether you're thinking a waiter, a hairdresser, or someone working at a hotel, news like this, that we're one step closer to a vaccine, gets all of those industries confident that they'll be back in business and start hiring much, much sooner. So that's a positive over here. Now let's talk about politics. It was a very big positive. We knew the markets would be up when we got definitive results, and that was a Joe Biden win. But then Joe Biden presented his coronavirus task force today, and that sent markets even higher. Why? Because politicians and citizens alike have been saying we need a national COVID plan. Big CEOs, Fortune 500 CEOs have said we can't get our employees back to work unless we have effective contact tracing and we really have access to rapid tests. Well, that's exactly what Joe Biden said he'd be delivering. So you saw big business respond well. And for small business, they've just been looking for direction. For months, we've talked to small businesses, schools, religious institutions, daycare centers that have said, we want to reopen, we don't know what the rules are. We want to reopen, we don't know how to keep our employees safe, our customers safe. What Joe Biden didn't lay out, but he did promise, was a clear plan and clear guidelines so everyone could get safe, get back to work, and hopefully get ourselves back to normal. And while we don't know if that's going to come to fruition, it starts with a plan, and that's what Joe Biden said he's got, and people seem to like it.